You're listening to Who Said, a Cardiology Board Review series. No fluff, just facts.
This episode is about interpretation of the waveform of the central venous pressure. I think it's really important to not just be relying on the numbers that are coming out of your right heart cath and your swan in the CCU, but also to be paying attention about the shape of the waveform because it can tell you a lot about the pathology that's going on. So this is a very interesting topic. You're also welcome to visit www.swanology.org, which is a digital tool that assists you with interpreting findings from your swan Gans catheter and right heart catheterization. With that, let's jump in. We'll talk about normal CVP waveform features, and then we'll talk about abnormal CVP waveforms. There are three peaks that are named, the A wave, C wave, and V wave. There are two descents that are named, the X descent and the Y descent, and there are no named valleys, okay? So ACV always refer to peaks, X and Y always refer to descents, meaning downslopes. No valleys are named. The A wave, which is the peak and occurs at end diastole, represents right atrial contraction. This is the atrial kick that occurs to empty the remaining volume in the right atrium that is left after most of the volume has already been emptied into the ventricle during the Y descent. The C wave, which is a bump that occurs at early systole, represents tricuspid valve cusps bulging into the right atrium because when the aortic valve opens as part of ventricular systolic ejection, it also causes the tricuspid valves to bulge into the right atrium. The X descent, which is the slope after the C wave in mid-systole, represents right atrial relaxation, which is why the pressure declines in the right atrium despite no loss of volume. The V wave, which is the lower peak that occurs in late systole, represents rapid filling of the right atrium as the IVC brings in systemic venous return. The V wave peaks at the point of mitral valve opening because once the mitral valve opens, the right atrial volume starts to empty into the ventricle, relieving the pressures in the right atrium. The Y descent, which is the slope that occurs in early diastole after the V wave, represents early ventricular filling, which is why the pressure declines in the right atrium as the volume empties into the ventricle. It is easier to see the X and Y descents on the physical exam of the internal jugular vein at bedside than the positive pressure waves, the AC and V peaks, because the Y and X descents produce much larger excursions. Now, let's delve into the abnormal CVP waveforms. What do giant A peaks, which are uniform in height and seen in every cardiac cycle, signify? It can either be tricuspid stenosis due to increased resistance and forward flow, or right ventricular hypertrophy because of decreased RV compliance that increases the amplitude of an atrial contraction. What are canon A peaks? Canon A waves occur when RA contraction occurs against a closed tricuspid valve because the ventricular contraction is occurring simultaneously as the atrial contraction. Canon A waves, variable in height, are seen sporadically because of the variable relationship between atrial contraction and ventricular systole. Regular canon A waves means junctional rhythm. Irregular canon A waves means ventricular tachycardia or complete heart block. So, to recap, giant A peaks, which are uniform in height and seen in every cardiac cycle, higher than the V waves, mean either tricuspid stenosis due to increased resistance and forward flow, or right ventricular hypertrophy because of the decreased RV compliance that increases the amplitude of atrial contraction. Whereas canon A peaks, also known as canon A waves, occur when RA contraction occurs against a closed tricuspid valve because the ventricular contraction is occurring simultaneously as the atrial contraction. And if you have regular canon A waves, it means junctional rhythm. Irregular canon A waves means it's ventricular tachycardia or complete heart block. What does the absence of A peak signify? That means atrial fibrillation because there is no organized atrial activity. What about a prominent V peak, or in extreme cases, a merged CV peak? that usually means tricuspid regurgitation, or it can also mean atrial septal defect. In this situation, the C and V peaks have merged, meaning the X descent is not discernible, to produce a wide positive wave called the CV wave. This occurs because the TR jet, the tricuspid regurgitant jet, increases the right atrial pressure, so the phase of right atrial relaxation is not accompanied by the usual reduction in right atrial pressure, causing the X descent to vanish. Other than in tricuspid regurgitation and atrial septal defect, the X wave can be diminished or disappear in any situation where there is a failure of atrial pressure to fall, namely constrictive pericarditis and atrial fibrillation. How about the opposite of prominent V peak? What does a diminished V peak signify? It means hypovolemia or use of venodilators. Since the V wave represents the combination of filling of the right atrium from the inferior vena cava in states of decreased volume or venodilator use, the V wave will be reduced. What about the unique situation where you have all the A, C, and V peaks merge into a single peak? That could either mean severe chronic tricuspid regurgitation or acute tricuspid regurgitation. This occurs when the heart rate is more than 120 and you have very bad tricuspid regurgitation. What does a rapid Y descent signify? Meaning it is very short, a very short Y descent that goes down. Constrictive pericarditis is the main situation. So when RV filling is hindered due to constrictive pericarditis, the descents become unusually short but still deep, and the JVP pattern follows an or W-shaped pattern. What is Friedrich sign? In constrictive pericarditis, the Y descent is often much deeper than the X descent, in contrast to cardiac tamponade, where the X descent is deeper than the Y descent. What does a prominent X descent signify? We just mentioned this, cardiac tamponade. What does a blunted X descent signify? We also mentioned this, constrictive pericarditis or atrial fibrillation. What does a slow Y descent signify? It could be cardiac tamponade, tricuspid stenosis, right atrial myxoma or thrombus, or tension pneumothorax. In cardiac tamponade, you have a loss of Y descent because the total heart volume is fixed. Blood cannot enter the right atrium if blood is not leaving the right atrium, whereas the X descent occurs during ventricular ejection, and blood is still leaving the heart during ventricular ejection, so venous inflow can happen and the X descent is retained. If I were to select one thing for you to remember in this episode is in constrictive pericarditis, the X descent is often much deeper than the X descent, in contrast to cardiac tamponade, where the X descent is much deeper than a Y descent. A few final words on waveforms of the RV, PA, and wedge. On the left side, on the wedge waveform, the pulmonary arterial wedge pressure, a high V wave means mitral regurgitation. On the right side, a high V wave means tricuspid regurgitation. How can you tell the difference in the diastolic segment of the wedge, PA, and RV pressure tracing? The RV and wedge diastolic segments will be upsloping because it is filling during diastole from the RA and from the PA respectively. RA is filling the RV during diastole, PA is filling the wedge during diastole. Therefore, the diastolic segment of the RV and wedge will be upsloping. Meanwhile, the PA's diastolic segment will be downsloping because it is emptying into the capillaries during diastole. That's all I have for you for waveform interpretation.
This podcast is intended for qualified healthcare professionals and is designed for training purposes only. These materials should not be used for direct patient care or as a substitute for independent clinical judgment. For more educational content or to submit suggestions, visit www.rehu.com/meded.